Hi everyone, I'm Nitya Zunikinanggit and Eskandar Mazain from Group 4. We would like to present biomedical imaging process. In this presentation contains into introduction, application, challenge and solution, future potential, case study 1 and case study 2. For the first, what is medical imaging? Medical imaging is the technique and process of creating visual representation of anatomy and physiology of human body in order to provide clinical analysis and medical intervention. Medical diagnostic itself divided into three phases. Consultation, where the information can be obtained from the patient by interview with a medical expert. Physical examination, such as inspection, auscultation, and also measurement. For the third one is medical tests, including laboratory analysis, biosignal analysis, such as ECG, EEG, and also imaging analysis, which will be focused in today's topic discussion. Medical imaging important to diagnose, treat, and cure the patient without causing any harmful side effect because we can see inside the patient without having to cut them open. From the modalities, the computer vision can exploit the texture, shape, contour, and prior knowledge along the contextual information from image sequence and also reconstruct the information to 3D and 4D information that help with better human understanding. As we can see here, the example of imaging modalities such as CT scan, MRI, nuclear imaging, ultrasound, SPECT, and also the X-ray. In general, modalities divided into radiography system, CT scan, MRI, ultrasound, nuclear imaging, and fundus image. Radiography system used to perform the diagnostic using X-ray procedure. In the X-ray examination room contains the radiographic imaging system and fluoroscopic imaging system. The fluoroscopic X-ray tube is usually located under the examining table. And the radiography X-ray tube is attached to an overhead movable crane assembly that permits easy positioning of the tube and aiming of the X-ray beam. The application of radiography system usually used in general radiology, orthopedic, pediatric, abdominal. There are few types of digital radiography such as DR or digitalized radiography and CR, computerized radiography. The differences of CR and DR is control interface, such as control axis, control button, and also the fluoroscopic system. Here the sample X-ray slices. Move to the computer tomography, or as we known as CT scan. The object is viewed from a number of different angles, and also the cross-section image can be computerized. The advantages of this system is provide 3D anatomical information and also topology of the bones. The drawback of the system is excessive radiation and not really good for all the soft tissue. In order to provide the most precise adjustment and fast processing to produce the high quality of image, the exam card can be set up depend on the CT scan needed. This is the 3D reconstruction in CT scan. Here the sample of CT slice. Magnetic resonance imaging. Magnetic resonance is a non-invasive imaging technique that produces series of the slice image with arbitrary angulation displaying the structure and function of the human body. This is the MRI system. A typical MRI system consists of three components or subsystems: the main magnetic field, a gradient system, and also the radio frequency system. This is the sample of MRI. Magnetic resonance angiogram uses a powerful magnetic field, radio waves, and computer to evaluate the blood vessels and help identify the abnormalities. This exam does not use the radiation, but require an injection of contrast material. Contrast enhancement is extremely valuable in many disease processes, including the tumor, inflammation, and also the infection. This is a sample of angiography. Move to the case study 1, an MRI traumatic brain injury longitudinal case study at 7 Tesla, pre- and post-injury structural network, and volumetric reorganization and recovery. The problem statement of this report is patient experiencing mild traumatic brain injury typically show the low frequency of positive MRI finding at 6 months post-injury, highlighting the need for more sophisticated and sensitive imaging technique in the clinical investigation of mild traumatic brain injury. A significant limitation of many neuroimaging studies examining mild traumatic brain injury is the unavailability of pre-injury data. This study aimed to utilize the pre-injury brain MRI and compare a collection of neuroimaging metrics pre- and post-injury to determine MTBI-related changes in evaluate and enhance the sensitivity of high-resolution MRI. The solution of this report is we leverage multimodal 7 Tesla MRI data acquired at 2 times point prior to MTBI and 2 time point post-injury to examine how a right parietal bone impact affect the gross brain structure, subcortical volumetric and microstructural order and connectivity. Technology used in this report is the new 7 Tesla MRI scanner. It will initially be dedicated to neuroimaging research. The level of inframillimeter resolution of the brain structure and the possibility of detecting with minute precision variation in the activity of the brain in action will allow to the work in field of neuroscience and neurodegenerative disease. The result of this report is the cortical gray matter and cerebral white matter in both hemispheres appear to be volumetrically reduced compared to the pre-injury and subsequent post-injury scan. Connectomes produced from whole brain diffusion weight probabilistic tractography show a widespread decrease in connectivity after trauma when comparing mean post-injury and mean pre-injury connection density. We report finding of initial volumetric change, decreased structural and connectivity, and also reduced microstructural order that appear to return based 6 months post-injury, demonstrating in-depth metric of physiological recovery. The advantages of this report is can investigate the neuroimaging in early stage of the detection and retrieve the change on pre and post-injury of the neurological disease using biomarker technique. And disadvantage or drawback of the system is physiological side effect is dizziness and metallic taste. And also the position depend on the flip angle, poor inversion, and unexpected contrast because of high magnetic field. The future recommendation of this case report is developments in the field of computational neuroimaging, such as morphometric subcortical segmentation and network theory may aid in the identification of suitable sensitive biomarker of brain
Image
injury.
processing, which is my topic, postural emission tomography is one of the image processing devices to pinpoint difference in tissue on molecular levels. The PET developed in 1998 to 2001 by Dr. David and Dr. Ron. There is some techniques for this device, which are the positive available techniques for some disease or disorder. The positive amount of radiation is small. Negative injection radioactive materials. And here is some sample about the PET image. As you can see, fundus photography, also called fundography, is the creation of the photograph of the interior surface of the eye. Including the retina optic disc macula fundus. Photography is performed by a fundus camera, which basically consists of specialized low-power microscope with an attached camera and posterior bulb. There is some symbol about the fundus image. As you can see in front of you, there is for image processing we can detect the vessels and the mechanism and also the hemorrhage inside the fundus image. The system of medical image processing divided to the three main sections: acquisition, which is the action of retrieving an image from the source; the second section, which is the processing, divided to multiple sections, such as pre-processing, segmentation, detection, analysis, diagnosis. The last three sections, which is the detection, analysis, and diagnosis, is called classification, as I will explain them deeply in the coming. Reprocessing of the image divided into filtering, which used to suppress the high frequency in the image, and smoothing the image. The image denoising, which used to estimate the original image by suppressing the noise from the image itself. The image registration used to align multiple sessions into single integrated image, such as rotation and cycle. Image enhancements used to improve the construct and the sharpening of the image to enable further processing. There is some algorithm used for pre-processing. Segmentation used to segment vessels, livers, cardiac imaging, and brain cars, and flag number, and so on. There is many type of segmentation algorithm that's used to segment the image based on the output you want to get. For each project needs to use a different algorithm to get a high performance and accuracy. Here I will mention some of them: K-means and VASI, narrow VASI, neural network based segmentation, snack algorithm, and their shoulding based segmentation. What's the detection in the image processing? It's a tool to find the location of the object of interest without prior knowledge about the location or existence. Example for detection in biomedical image processing: bones, organs, detection polyps in colon and nodules in lungs. Classification or diagnosis: that's use to comparison to flopped atlases, use of knowledge database, and classify as a normal abnormal brain. Classify long nodules such as benign and malignant. Determine cancer, non-cancer. The image processing application, which is in medical image comparison, medical image diagnosing, image filtering, medical image retrieval, mammograms, tumor detection, medical image fusion. Why we use comparison for medical image? The benefit of the comparison is the growing need for the storage to efficient data transmission, telemedicine, teleradiology application, real-time teleconsulting, picture archiving, and communication system. While comparing the medical image, there is some specification used in the comparison as algorithm, comparison algorithm, and lossy and lossless. For the medical image should always be stored in lossless format. Why? Because we can exactly recover the image itself. If we delete it, if it's lost, it can be recovered using the lossless comparison. The noise diagnostic and its legal implication. In slides we show the difference between lossy and lossless. For the lossy we use low motion area, and for the lossless we use the high motion area. While using slice, there is some encoding used as a group of macro blocks. First slice for high motion area and the second slice for the low motion area. Slice may be encoded at different rates as shown in the picture below. Medical image fusion. PET or CT scan. Multiple modality image are registered and overlaid or married to provide additional information as showing for the medical image fusion as the three different image and the detection. What medical image retrieval for the medical assistance, difficult cases detection and diagnosis assistance, for the education, better training by the recognition of the similar symptoms, for the researcher, medical image data mining. For the medical image retrieval, here is some example as the input image and the result. Diabetic retinopathy using the ultrasound is the earliest clinically detectable lesions that's detected the hemorrhages and the mechanism as showing in the picture below for the healthy retina and the diseased retina, which is retinopathy. For the healthy retina, as you can see, the retina is so clear, there is nothing on it. But for the diabetic retina, there is hemorrhages and microaneurysm vessels is so wide. Proposed retinal abnormality detection and classification approach. The problem statement, which is the diabetic retinopathy, is a common a complication of the diabetes and the primary case for visual impairment and blindness in adults that is caused by changing in the blood vessels of the retina. The mechanism are focal dilation of retinal capillaries and appears as small round dark red dots. The hemorrhages occur when blood leaks from the damaged retinal vessels. The exodus occur when the fat leak from the abnormal blood vessels of the aneurysm. It's not possible to diagnose the diabetic retinopathy using the laboratory test. For the regular screening is essential in order to detect the early stage of diabetic retinopathy for timely treatment to prevent further deterioration of the patient. To solve this problem, we have to design a framework for automatic detection of diabetic retinopathy based on image enhancement model, segmentation model, which include detection of abnormal blood vessel and identification of the optic disc, exodus, and mechanism feature extraction model to extract vessel parameter and classification model to identify the diabetic retinopathy and non-diabetic retinopathy. Design and enhance artificial neural network classification algorithm based on segment feature to classify different stages of diabetic retinopathy into normal, moderate, severe, and non-proliferative diabetic retinopathy (NPDR) and proliferative diabetic retinopathy, which is PDR. Developed a pilot prototype of computer-assisted system for accurate classification and grading for retinal image, evaluate and improve the performance based on the sensitivity and specificity and accuracy and predictive value. There is 5 techniques used in this project. The first one, retinal photograph image techniques. It has facilitated develops of computer-assisted method to measure and quantify suitable variation and abnormals in the retinal microvasculars. Laser photocoagulations. If the disease is detected in the early stage by using these techniques, we could have slowed down progression for the diabetic retinopathy. Automated diabetic retinopathy mass screening system which offload the work of the ophthalmologists and also decrease the waiting time of the patients and the hospital to some extent. Automated computer-aided detection and diagnosis methodology is divided into 4 models by machine learning approach, which is pre-processing and extract the features, segmentation, and the classification. Some advantage and disadvantage for this project. The advantage, retinal image allow doctors' eye to see the signs of the IDCs that they couldn't see it before. Laser photocoagulation reduce the risk of the further vision loss. And the purpose of the screening is to identify people with the diabetics who are at the higher risk of the developing sight-threatening diabetic retinopathy. So the early treatment or intervention can be offered to reduce the incidence of motion impairment or blindness. The disadvantage, they increase the cost of treatment. Neuro offers the higher magnification, but a smaller photographed area of the retina has been detected. The mechanisms are difficult to segment due to their similarity in the color. There is some future recommendation for this project, which are NovaGo Therapeutics is developing a first-in-class fully human antibody therapy to treat diabetic retinopathy. With its novel disease-modifying mode of action, it could save the size of the many patients who respond poorly to current treatment. The computer-aided detection system to classify the retinal image using machine learning approach has been proposed for prototype development and will be validated with the virus samples. And now I'm conclude my case study. The computer-aided detection system to classify the retinal image using machine learning approach has been proposed for prototype development and will be validated with the virus sample. The proposed method is capable to detect of the diabetic retinopathy stage sharply by improving the accuracy. The classification result of proposed method will be comparable to those optioned by other methods. The major strengths of this proposed system are accurate feature extraction and accurate grading of MBDR lessons. Hence, the proposed system gave more accurate classification and grading of retinal image. For the classification image processing, most of the medical image processing system consists of pre-processing, enhancement, filtering, segmentation, and detection. Thank you.